Record. Okay. I'm Georgia.
I'm Destinee.
And I'm Tia. We're fourth-year nursing students at Bedford Road Collegiate.
Today we're going to be talking about STBBIs and contraception. So what is an STBBI? STBBI stands for sexually transmitted bloodborne infection. These used to be commonly known as STIs or STDs. Majority of these infections are spread through sexual contact, such as semen, vaginal, and other bodily fluids. Others can be transmitted during pregnancy, childbirth, and breastfeeding, and through infected blood or blood products. If STBBIs go untreated, they can cause serious consequences such as death. So risk for getting an STBBI. Having unprotected sex, so vaginal or anal penetration from someone not wearing a condom increases the risk. Improper or inconsistent use of condoms also increase the risk. Having sex with multiple partners, so the more people you have sex with, the greater risk of developing an STI. Having a history of STIs makes you more prone to getting them again. Misuse of alcohol or recreational drugs. Substance misuse can inhibit your judgment, making you more willing to participate in risky behavior. Being young, so half of new STIs occur in people between the ages of 15 and 24.
Some of the most common STBBIs are HPV, herpes, syphilis, gonorrhea, chlamydia, and HIV. And chlamydia is the most common STBBI in Saskatchewan.
So what causes STBBIs? There's bacterial and viral ones. Some bacterial ones are gonorrhea, syphilis, and chlamydia, and some viral ones include HPV, genital herpes, and HIV. So gonorrhea, spread through vaginal, anal, and oral sex. In many cases, gonorrhea presents with no symptoms. It can also infect other parts of the body, including your rectum, eyes, throats, and joint. Some common symptoms in women are painful urination, vaginal discharge, and bleeding. So this means that discharge that you're not used to seeing and that's not common for you, so such as a thick green or yellow, and bleeding may occur in between periods or after intercourse, abdominal pelvic pain, and for men, painful urination, penile discharge, and testicular swelling.
The treatment and care of gonorrhea includes an antibiotic that's given just one time as an injection. Although the medication will stop the infection, it cannot fix any damage, so it's important to treat it as soon as possible to minimize the damage. Reinfection is common, so it's recommended that you get retested 3 months after your first infection, and public health will follow up with you and with your partners because it's recommended that any sexual partners also get tested. So it's important that you tell the doctor or nurse who you've had sex with so that they can contact those people to get tested too, and it all remains confidential.
So next we have syphilis, and this is one of the most common rising ones in Saskatchewan. And syphilis is a common bacterial infection that's spread through vaginal, anal, or oral sex. Syphilis is easily cured with an antibiotic medicine, but it can cause permanent damage if you do not get it treated right away. This does come in stages. So stage 1 includes painless open sores that can be on the mouth, anus, or genitals. They typically appear after 3 weeks to 3 months, and they are super contagious. Stage 2 can include rashes on the palm of your hands, soles of your feet, and this rash can last from 2 to 6 weeks, and it can come and go if not treated. And then the last stage includes damage and tumors and blindness and paralysis, and it's really affecting your brain. So here are some pictures. Stage 1 is those open sores. Stage 2 is what that body rash can kind of look like on your hands and feet. And then stage 3 is just when it's affecting those organs. So treatment for syphilis. Penicillin is the #1 medication. Usually 1 injection should treat an infection. Long-term syphilis can take up to 3 injections, usually one every week for 3 weeks. And as you can see, this is pretty thick fluid in here, so it can be pretty painful.
Next, we'll talk about chlamydia. It's commonly spread through vaginal, oral, and anal sex, and it can also be spread during childbirth. Early signs of infection often cause few or no symptoms and can be confused with a UTI or bladder infection. It affects mostly young women, but affects men as well. and is the #1 most common STBBI in Saskatchewan. Some symptoms include disordered bleeding, so bleeding when you wouldn't expect to be bleeding, like between periods or after sexual intercourse. Vaginal discharge, like Destinee talked about, that's any kind of discharge that isn't normal for you. And then painful urination. For men, painful urination, penile discharge, and testicular swelling.
Some treatment of chlamydia can be effectively treated with antibiotics, such as just pills, doesn't have to be an injection. And you should wait until you have finished full treatment before having sexual activity to make sure that the antibiotics have worked. And if you're under 25, you should be offered a repeat test every 3 to 6 months after finishing treatment, just because we are in that age group that is very high for the STBBIs. And when you test positive, it's important that your sexual partner also get tested. So that will be public health who gets a hold of them in order to keep confidentiality on your part.
So HPV. HPV is a viral infection that commonly causes warts and some may cause cancer. Infections are commonly transmitted through sexual activity and skin-to-skin contact. So genital warts, these are flat lesions, cauliflower-like bumps, and in women appear on the uvula near the anus or the cervix, and men appear on the penis, scrotum, or near the anus. Warts typically do not cause pain, but they may itch. So cervical cancer, this can take up to 20 years to develop. When you're young, you usually get a vaccination against HPV. And once you're 21 or once you're sexually active, for women or people with a vagina should get a pap test done. Plantar warts, hard growths that appear on the heels of your feet and cause discomfort. And there's flat warts, so flat top slightly raised lesions. And then common warts appears rough, raised bumps, usually appear on the hands and fingers and can be painful and bleed. So if you have a wart, it's best just to go get tested and see your doctor and see what they say. So here are just some pictures of HPV. There's the genital warts, the flat warts, the plantar warts, and the common warts.
Now, for protection against HPV, condoms help prevent against it, but they don't fully cover all of the skin around your genitals. They only cover the shaft of the penis. So you are not fully protected because HPV can be spread through skin-to-skin contact. The HPV vaccine is also a way to protect yourself. And in this case, protect against the causes of HPV that cause these genital warts and cervical cancer. So the main reason that we vaccinate is to prevent that cancer. And this is now offered to boys and girls, usually between the ages of 12 to 13 in school. But if you're watching this and think that you might want a vaccine for HPV and are older than that, that's still totally okay. It's just something you need to talk to your doctor about, or a walk-in doctor or something like that.
So next we have treatment of HPV. So there is typically no treatment for HPV. Most HPV infections are cleared by your body in 2 years. Treatment for HPV is needed if it's causing problems like genital warts or changes to the cells in the cervix. And then warts can be frozen off by a doctor or a prescription medication.
So genital herpes. So genital herpes is common sexually transmitted infection, the herpes simplex virus, HSV. Genital herpes can often be spread by skin-to-skin contact during sexual activity. It can be passed through oral sex if another person has herpes simplex virus, so a cold sore. That can be passed. That is the herpes simplex virus. So if you have oral sex while it is present, you're most likely to give it to your partner and give them genital herpes. Sores can develop on the mouth, anus, penis, vagina, cervix, urethra, thighs, and scrotum. So pain or itching around the genitals, small bumps or blisters around the genitals, anus or mouth, painful urination, and discharge from the vagina or penis.
Now, genital herpes treatment. So there is no cure for genital herpes, or even just normal, any HSV, even cold sores, there's no treatment, or there's no cure for it. As a treatment, you may be prescribed something called an antiviral, and this is just to help keep the sores small and keep them from spreading all over your body, and then also to lessen the chances of you transferring or passing the herpes to somebody else.
Next, we have HIV, human immunodeficiency virus, and HIV is a virus that attacks the immune system. It damages your immune system, and HI interferes with your body's ability to fight infections and diseases such as a common cold. HIV is a sexually transmitted infection. It can be spread through vaginal and anal sex as well as oral sex. It can be spread by contact with infected blood and also from injection use, so sharing needles. And it can also be spread by mother to child during pregnancy, childbirth, or breastfeeding. It's not to say that people who have HIV cannot have children, because there's lots of options for that to make sure the child will be okay as well.
So some symptoms are fever, diarrhea, night sweats, cough, weight loss, headache, painful mouth sores, and swollen lymph nodes. And I believe the most common two are night sweats and weight loss.
HIV treatment, another one that there is no cure for. There are certain medications that are used to help decrease the replication of bad cells, which give your body a break, but there's no cure.
How to prevent HIV. So number 1 would be using a condom. Number 2 is to get tested. Number 3 is to take PrEP. And number 4 is to get on treatment. So PrEP is pre-exposure prophylaxis, and it can reduce your chances of getting HIV from sex or injection drug use. And that would just be a pill that you take.
So how can you protect yourself from STBBIs? So the only way to actually prevent this fully is to abstain from sexual intercourse, stay with one uninfected partner, get vaccinated for HPV, use condoms consistently and correctly, communicate with your partner, test, make an appointment with a doctor or visit a walk-in clinic, get tested regular at physicals if you are sexually active, get tested when you have a new sexual partner, and a pap smear at 21, or if you're sexually active before that, treat antibiotics or antivirals, take as prescribed, notify sexual partners if you test positive so they can get tested as well.
Now we're going to start talking about contraceptives and birth control. So condoms, these are just different types. Condoms are 98% effective. Diaphragms, 87% effective. The pill, 99% effective. IUDs are also like 99% effective. The shot, 99% effective. The implant, over 99% effective. And the patch is 93% effective. And a fun fact is that some birth control methods or contraceptives can also prevent against STBBIs. So an example of that one would be a condom. Also something like a dental dam if you're performing oral sex, just to keep that skin-to-skin contact non-existent, basically.
So first we're going to start by talking about condoms. So this is just an example of one. A condom is a protection device used during sexual intercourse to reduce the probability of pregnancy or a sexually transmitted infection. There is a male condom, which this is the example of, and then we also have female condoms as well.
So how to use a male condom. So this is our demonstration right here. So first you want to check the date. So this one says expiry date 2025. So that's good. You want to check to make sure there's air, to make sure there's no holes present. And then we're going to open it, pull it out, look which way it goes to make sure that the rim rolls. We're going to place it, pinch the top so you leave a bit of space up here. And then we're going to just roll. And then the reason you're leaving space is so that the contents can go in and not explode and impact anything and leak or make a hole. And then after intercourse has finished, you're gonna roll it from the base. So if you just pull from here, you're gonna spill everything everywhere. So you're gonna roll it from the base, pull it off, tie it off, and put it in the garbage and not in the toilet because it can clog your toilet.
Next, we'll talk about diaphragms. So a diaphragm is a form of birth control. It's like a shallow cup. So it kind of looks like a mini, like super short condom. It's a soft little silicone piece and it fits inside the vagina right around the cervix. And this is to prevent, it's like a barrier to stop sperm from getting into the cervix. But for it to work, you have to put a spermicide. So this is an example of a spermicide here. And it's just like a gel that you have to put inside of the diaphragm before you insert it into the vagina. And this liquid actually kills sperm. So then if any sperm do make it around that diaphragm, they will be killed by the spermicide. Again, this isn't a super effective birth control method, and it cannot prevent against STBBIs. It's always recommended to use multiple forms of contraceptive.
Next, we're going to talk about birth control pills. Here's just a little example. Birth control pills are a kind of medicine with hormones. Birth control pills make sure the body does not release eggs, so sperm cannot fertilize the eggs and create pregnancy. Birth control pills come in a pack, and you take one pill every day. You can get them labeled so they have the days of the week as well. And this type of birth control must be taken at the same time every day in order for it to be that 99% effectiveness. And this one also does not prevent, again, STBBIs.
It's also important to note that the birth control pill, its effectiveness can be impacted by other medications that you take, like antibiotics from your doctor. So it's always important to get that double checked if you get an infection and you need to take some antibiotics to make sure that it is not impacting your birth control pill. Also, drinking alcohol can also impact this. So
IUD. So it's a T-shaped piece of plastic or copper that is inserted into the uterus and used to prevent pregnancy. IUDs are long-term. They can be left in for 5 to 10 years, may cause a woman to not have their period or lessen the effects. And this, again, cannot prevent against STBBIs, just to help prevent pregnancy. So this is our example here. This just gets inserted, and then it gets inserted into the uterus with, it looks like this. This is how the stick, it gets pushed up there and inserted. And when you pick it up, it comes in this big box. It's not actually that big. Again, it's just like this small, so very tiny. So don't be scared when you see this big box.
next we'll talk about the injection, so the depot shot. So it comes in a little vial like this, and the nurse or doctor who is going to inject you with it will obviously draw it up into a syringe with a needle and just inject it right into your arm. It's a hormone progestin in the birth control shot, and this prevents ovulation. So it prevents the release of an egg during your menstrual cycle, just like the birth control pill, except you only need to get this every 3 months. You don't need to take it every day like the birth control pill. But one important thing to note is that the depot shot actually decreases bone density, and it's not recommended to take beyond 2 years. And if you are taking it, you should probably take a calcium supplement as well.
Next, we have the implants. So Nexplanon is an example. It's a birth control implant that is placed under the skin of the inner non-dominant upper arm, and this is done by a medical health professional. This device stops the egg from being released like the other ones, and it prevents sperm from reaching that egg. It lasts about 3 years, and it may cause less bleeding with your menstrual cycle or have no period at all, which would be normal.
And that bottom picture is just how it gets inserted, but just note that it's not as scary as it looks. You do get numbed before they inject it.
So the patch. The patch releases a daily dose of hormones through the skin into the bloodstream to prevent pregnancy. The patch contains the same hormones as the pill. Each patch lasts for 1 week. You can change the patch once a week for 3 weeks, then take it off for your period week. So if you're going to use the patch, just remember that, say you decide to place it here 1 week, that you want to switch spots. So go to the torso, the buttocks, or the abdomen. Don't place it in the same spot the second time. You need to rotate every time you use it.
And if it happens to fall off in the shower or something, you just have to put a new one back on when you get out of the shower. Here are just some resources in the city that you can reach out to. So there's Saskatoon Sexual Health, or Out Saskatoon, and they supply condoms and diaphragms for free. They can help figure out some birth control options for free as well. And they also have free STI testing if you feel that you may have been infected. Then there's also walk-in clinics, which you can also get birth control and free contraceptive options and testing as well.
There's also harm reduction sites all over Saskatoon with the Prairie North Health region that will offer different forms of contraceptives as well.
Thanks for watching.
Thank you for watching. Yeah.